Okay, so that the we are discussing the procedure of the blood transfusion. So first thing we should means describe all the procedure to the patient and all the possible complications or possible the transfusion reaction that can happen to the patient must uh, educate to the patient as well as the attendant. And next thing you have to enter all the details of that the bottles of the blood, means what are the numbers and the date, manufacture date. You have to check the date of expiry and all these things detail must be checked, and documentation should be proper. At the end you also mention the time of starting of the blood transfusion. Okay, and you must use in any every phase of the blood transfusion you must have to use a new sterilized blood transfusion IV set. Okay, that is different from that normal IV set. With the normal IV set you cannot transfer the blood. Okay, there is different IV set is there for, called the BT set. You have to use fresh BT set in every uh, uh, every case for the blood transfusion. Okay, so and you there is you can connect no need to place new IV cannula. You can place it in the that older IV cannula which are previously placed for the IV fluid. In that cannula you can use that only. Okay, and make sure the blood should be warm up to the body temperature. What should be our normal body temperature? Is the 36 degrees centigrade. So we should at least you have to make the warm the blood before before transferring to the patient. So the simple procedure is that you just wrap in the any cloth and you ask the attendant to keep inside the shirt, just means in the close contact to the body, so it will warm very fastly. Okay, so next thing that what should be the speed of the blood transfusion. So usually that starting from the starting uh, 1 ml to 2 ml per minute, 1 or 2 ml per minute usually just start with this. So you can see that 1 ml of blood IV fluid is almost having 16 drops. Okay, so you can start from the 16 to 30 drops per minute. Okay, that if for the first half an hour, the first 30 minutes, if there is no transfusion reaction is there, if there is no problem is there, vitals are normal, patients have no complaint any kind of, then you can little bit exceed and increase and up to the 4 5 ml per minute. Okay, so complete blood transfusion process should be finished in uh, 2 to 3 hours, maximum 4 hours. Okay, so at least you have to, means that excuse is very important because if you start infusion in very high speed initially and any kind of that coagulation reaction is there then very difficult to control that reaction. Okay, that management will be very difficult. That's why initially you start very slow speed, 1 to 2 ml per minute, and later on you can increase the patient after half 30 minutes. If the patient has no problem, you can increase it, and you have to finish all that complete transfusion from the 3 to 4 hours. Okay, this should be not exceeding 4 to 5 hours because uh, that the blood may be become very warm or may have any kind of that coagulation will be there if you the time prolong very much for the transfusion. Okay, and in that period of the transfusion you must have to take all the vitals regular basis. Okay, that means the pulse and the blood pressure, and you have to regular check that lungs of the patients. Okay, and heartbeat. So these vitals should be regularly monitored in that patient while doing the transfusions to any to find out any kind of the reactions. Okay, so there the transfusion reactions are there, and which are discussed in this slide. The transfusion reaction means which are reactions happen due to the blood transfusion. So most common and most severe is that incompatibility. ABO incompatibility is the most severe reaction which can happen while the transfusion. Suppose anyhow if you do it wrong and you have transfused the wrong blood, means patient of that blood group A have received the blood of the blood B. Okay, means in the cross matching is not doing properly and exercise, and that then incompatibility, ABO incompatibility happen. So if you infuse ABO incompatible patient blood group, means the blood group is incompatible to the patient, wrong blood you have infused in any patient, then what should be that hemolysis, means or the coagulation starting coagulation have the blood is start coagulating inside the body. So this is the very severe reaction, and in that condition that there will be the multi-organ failure. Okay, so there is very difficult to save the life of the patients. Okay, that's why I'm saying you have to make always double check by you and by your assistant before transfusing the blood. So ABO incompatibility is a very severe reaction. So it should be avoided, but it happens sometimes. Okay, and some other reaction, that some milder antigens, antigens, suppose so many type of antigens are present in the blood. So if any patient receive any kind of the blood, and that recipient antibodies are reacting against that antigen, also that time some milder reaction may be there. Okay, so due to that reaction, patient may have fever, chills, and rigors. So these are the basically means symptoms which appear in that patient. Patient may have chills, rigors, and the high grade fever. Okay, and some anxiety on okay, so these things if happening any patients, you must so in that condition what you done, you must first thing you have to stop the blood transfusions. Okay, don't continue with that transfusion if any kind of the reaction is there. Okay, and you immediately you stop the IV fluid. Okay, and you give to the, if you suspect any kind of the incompatibility, you start diuretics. Better you can start the one furosemide 1 ml, furosemide IV 1 or 2 ml you can give the patient, so that so it can increase the diuresis. So if there is any kind of the means blood filtration is increased, so any kind of antigen is there, so it can be thrown from the body with the urine, and give the antihistaminic along with the hydrocortisones in that allergic condition. So your patient should not go any kind of the anaphylactic shocks. Okay, and in severe incompatibility cases, that dialysis may be required in some cases. And if there is any other symptoms are there, then symptomatic treatment you must have. Suppose patient having chills and like then you can give the patient that extra blanket and all this covering of the for covering of the patients. Okay, so these are the transfusion reaction which can happen in the patients, and by these methods you can trying to you can control it. Okay, so the next is the complications. So these are some few complications which can happen while the transfusions, that are categorized in basically two types. That can happen in a single transfusion, and that can happen due to the multiple transfusion. So single transfusion is that first thing, that uh, incompatibility can be happen, because with a human error it can be happen, incompatibility reactions. and patient may have high grade fever, that febrile transfusion reaction may be there. Patient may be allergic sometime, because sometimes that the recipient is not received as things which should be received. So there is the donor graft reaction sometimes happens, means that patient, that recipient blood is not receiving properly, that blood is to in that which blood is infused to that patient. So some allergic reactions may be present. Okay, and some infection may be travel to the blood transfusions, that is some bacterial infection, some viral, that's like hepatitis, and that HIV infections, and some malarial infection can be happen with that blood transfusions. Patient may have that the problem of air embolism during the transfusions. Patient may have the thrombophlebitis. Okay, if anyhow the you have transfused the blood in very high speed initially, then patient may have some kind of the lung injury. There is the congestion in the lungs. So that are the these are the complications which can happen in the single transfusion also. And if the patient is any patient is receiving transfusion again and again, so that then some problems that can happen, that is the coagulopathy, because that whatever blood is received by the patient is having high very high concentration of the anticoagulants. Okay, so that patient may, and that due to the high concentration of the having receiving, because patient receiving transfusion again and again, so the blood having high concentration of that anticoagulants, so the coagulopathy may be developed in that patients. And because of that that acetate and citrate is citrate as an anticoagulant is present in the transfusion blood, so that consumes so much calcium in the body, so that citrate consumes so much free calcium in our body, so that may lead to the hypocalcemia. And the hypokalemia and hyperkalemia, these are the conditions with the potassium, because the potassium present in the RBCs when during the storage process, these can be these RBCs lose so much potassium from the their cells. So if that blood is transfused to the any patient, so the patient may have the hyperkalemia. And later on, then when the blood comes into that into the circulation, then again they uptake high amount of the potassium from that cells tissue, from that circulatory fluid, so that may go into the hypokalemia. So these are two conditions, hyperkalemia and hypokalemia, they can happen when the patient having massive transfusions. And when the that hypothermia is also a condition if the patient is receiving so much blood. So it is not possible to always to warm the blood every time. So sometime in emergency patient can receive the little colder blood, so that may lead to the hypothermia. So these are the few complications which can present if the patient receiving massive blood transfusion. Okay, and these are the some which can happen in the single transfusion. So one question is there, how much amount of blood a patient can receive? Okay, so this is the best things. This best line is some writer says that the best amount of blood to give is the least amount of blood that is needed. Okay, means the amount, the lowest amount of blood which is required for the survival of the patient. This is the best amount to transfuse any patients. Okay, so the best amount of the blood to give is the least amount that is needed. Okay, so this is very important things. So now that blood transfusion process is complete. So now if